Okay, good morning, everybody. Welcome back. It's week 2 of Cardi-OH program, Your Patient with Diabetes at Risk for Heart Disease, a series of case discussions. I'm Jessie Lewis, the clinic coordinator. I'll go through a few items that we covered last week and give some contact info. And with that, I'll go ahead and turn it over to our facilitator, Dr. Rao, and we'll get started.
Thank you, Jessie, and welcome, and thanks to everyone for joining us for our second week. We have an interesting lecture that Liz and I hope it's interesting, will present to you. We also have two really great cases, including a case of a patient with diabetes who's untreated, which I find is going to be a really interesting basis for our discussion. So the lead discussants are going to be Doctors Beverly and Prosinsky. So the way this is going to work is after we've completed our short didactic presentation, we will plunge into the case presentations as well from Doctors Keela and Laura Marson. And after each presentation, I will ask Doctors Beverly and Prosinsky to start with their comments, after which we will open it up to the entire group. This is just a list of our participants. So you've seen this from last week. And this is just the format for today's session. And here are our disclosure statements for this particular session. And very importantly, we will be using patient-centered language throughout this ECHO series, referring to gender and disability, socioeconomic status, race, and sexual orientation, using the preferred terms that are listed here. Okay, we're ready to get started, and I believe Dr. Beverly is going to start us off.
Thank you, Dr. Rao. Hi, everyone. I hope everyone's having a good morning. Today, we're going to be talking about literacy, numeracy, and diabetes. So the objectives for this brief didactic are to describe the scope and impact of low health literacy on self-management of type 2 diabetes. We're going to define patient numeracy and describe the impact of low patient numeracy in the self-management of type 2 diabetes. So I'm going to give a very brief overview of health literacy. So the definition is the degree to which people have the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. And if you're looking at the statistics globally, as well as within the United States, globally, the prevalence of low health literacy in adults with type 2 diabetes is a little bit over a third of adults globally. In the United States, it's about 29%. So you can see we have really high rates of low health literacy in adults with type 2 diabetes. I just want to make one important point here, that education is a variable, and I refer to education in terms of years of education that does mediate the relationship between health literacy and health outcomes. And so the mediation is just a way in which a variable acts through or can form that causal relationship, such that more years of education can then lead to better outcomes if there's lower health literacy. And then just to follow up on that, when we're talking about low health literacy and when we're talking about years of education, that in no way is a representative variable for intelligence. So it's really important to keep in mind that health literacy is not an indicator for intelligence, and as well as years of education. So when thinking about low health literacy, what is low health literacy associated with in terms of type 2 diabetes? Well, this has been studied very widely, and so here are some of the associations. Low health literacy is associated with less diabetes knowledge. It's associated with higher A1C levels. In terms of self-care, and again, self-care is pretty hard to manage when you're doing research with type 2 diabetes. It's really hard because you have to do a lot of self-report. And so with self-report, low literacy is associated with decreased exercise and decreased foot care behaviors. But again, keep in mind with self-care, it's really hard to objectively measure those behaviors. Low health literacy is also associated with difficulty communicating and understanding medical terms. And there's less of a desire to participate in shared medical decision. And we know that all of these factors are really important in diabetes care and having an effective patient-provider relationship. So in terms of literacy, there are actually different types of health literacy. There's oral literacy. So this is in communicating with someone, so speech and then comprehension. So when we, on the previous slide, we were just talking about the understanding of medical terms. In terms of print literacy, a lot of times there are patient handouts, or patients will go to perhaps a diabetes self-management class, and they'll receive materials. There's also print literacy, so this has to do with reading and writing. And then also there's numeracy. And this is the understanding the application of numbers. And so we're going to go into greater detail about numeracy, and I'm going to pass this over to Dr. Rao.
Okay, thank you, Liz. Let's do a brief thought exercise. I was trying to convince a patient yesterday morning to take the COVID vaccine. In the back of my mind immediately was the idea that the two recombinant vaccines, Moderna and Pfizer, are 90% effective. I'm not going to ask people to comment, but how would you explain 90% effective to our patients? From a technical standpoint, it's the risk among those who are unvaccinated minus those who are vaccinated divided by those who are unvaccinated, and you come up with a proportion. That's not going to work. Could you say to that patient that if 100 people are in a room where COVID-19 is circulating, and among the unvaccinated, 10 people would get the disease, but only one person would get it if they were vaccinated? It seems like pretty logical. That's not going to work either. There's a robust literature saying they will not understand that benefit. And let's think about another simple thing. How many of you have told people, I know that not everyone here works with patients directly, but many of you do. And I've said this as well, you need to turn the dial on your CPAP machine counterclockwise for a better fit or a better flow rate. How many of people have said things like that under the assumption that people would understand what counterclockwise and clockwise actually are? The reality is quite different. So let's talk about numeracy. It's broadly, as Liz said, the ability to understand and work with numbers. Health numeracy is the degree to which individuals have the capacity to interpret numerical, quantitative, graphical, statistical, probabilistic information that they need to make effective healthcare decisions. Next slide. So I got interested in this area because I was a victim of poor numeracy myself back in 1990, in the late 1990s when I started practicing. There's an editorial in the journal International Pediatrics, which talks about a young physician and a nurse just out of nursing school. The physician accidentally ordered 100 times the dose of racemic epinephrine for a toddler, a little girl with croup, but he stopped the nurse from administering it at the very last moment. And of course, that was me. And I thought to myself, what had happened? I'd gone through college and medical school and I'd done well. Why have I become so incompetent with numbers? And of course, that initiated the whole idea that physicians suffer from poor numeracy, but we're talking about patients. Next slide. So common numeracy skills, counting, of course, if you can count, you need to count to be able to add, understanding times and dates, graphs, tables, fractions, decimals, probability, and of course, the applied skills, which are more complex, multi-step math problems, estimation, applying logic, etc. These seem like they are a little bit divorced from health, but they certainly are not if you're trying to calculate, and we don't use sliding scales, I know, for insulin, but for example, that would be something that requires more advanced skills on the part of a patient. Next slide. So how common is this problem? It is extremely common. It's also very, very much in the dark. People are embarrassed to acknowledge their poor numeracy or just don't, they've coped with it. They've developed workarounds that allow them to function at a certain level. So given a bus schedule, and this is a classic problem from the University of Chicago. If you have a bus schedule and you are told when a bus is going to arrive and you are told what time it is now, 32% of American adults cannot figure out how long they will be waiting for the bus, okay? So we know, first of all, low numeracy is strongly associated with poor diabetes control. It is one of the most highly predictive factors. So among the low numeracy patients, diabetes control is worse, and not only worse because of other factors, socioeconomic status, etc. It's worse because of their low numeracy, because they're not able to work things out numerically to optimize their control. Next slide. So final slide, what do we do about this? This is a vexing problem. Number one, we cannot fix the problem ourselves. I tried that for a while. In other words, training patients to better understand, to give them the numerical skills to better understand and manage their illness. And so this doesn't work for a number of reasons. First of all, most of our patients with type 2 diabetes or at risk for heart disease, for example, are well into their 50s, 60s, 70s. They have been working with low numeracy most of their lives. They're reluctant, or perhaps just not in the spirit of learning new skills that they've forgotten or don't use on a regular basis. So teaching them about ratios and proportions is, first of all, not terribly well received and may not be effective. And it could be very frustrating for those who are tasked with it. The time to teach numeracy, of course, is to children. And I know that several people are very passionate about this issue. So this is beyond schoolwork, but there are programs to help children better understand their numbers. And actually, children and adolescents with type 1 diabetes sometimes go through that sort of training quite successfully. Now, so the number one thing you can do is to be aware of that 1/3 of your patients, and that may be higher in the Medicaid population here in Ohio, at least 1/3 of your patients have low numeracy. So how you communicate to them is critically important, okay? So I told you vaccine efficacy is 90%. You don't put it into an odds ratio. You don't talk about if 100 people walked into a room, only 1 of the vaccinated people versus 9 of the others would get COVID-19. You put it in terms that people are accustomed to hearing on television or on the radio. Your chances of getting COVID-19 are 90% lower if you get the vaccine, okay? You have a 90% less of a chance of getting something if you get the vaccine. So that's one way we would express it. The other second thing that I would recommend is for you to assess numeracy before you start to make changes to assessment or treatment, which will influence your particular care. This is there are numeracy skills and tests, etc., but this is not how I would recommend you do it with pen and paper in your clinical setting. But let's look at this question. You're told to follow the sliding scale shown here. If your blood sugar is this, this, and this, how much insulin would you take for a blood sugar of 295? And of course, the answer is 3 units. This seems straightforward because it's looking at which numbers fall into which ranges. But this is an important part of teach back. If you were to follow this, and I don't recommend sliding scales necessarily, but if you were to change a dose for a medication, ask the patient to teach back not the name of the medication or when they take it or what it is they're taking, but how much they would take based on a numerical value, and correct them if they are not in the correct range. This is the kind of thing we should be doing for all of our patients as often as possible. So this is a huge, huge field. Much has been written about it. Just in terms of health literacy, of course, as well. I wish that Liz and I had lots of time to talk about this, but I think we'll have a couple minutes now to take some questions before we plunge into our cases. So I'm going to turn things back to Jessie for a brief moment and we'll wrap up.
Great. Thanks, everyone. Just a few items. So remember that you can watch recordings of these clinics on our website. The current clinic, you do need to register for an account on Cardi-OH.org, but then the video recordings of our didactic presentations will be available to you. You can also access any of our archived clinics, so our previous TeleECHO clinics are also available to you. And if anyone has any trouble making an account or needs help, please feel free to email us. And then another reminder, your post-clinic survey should be in your inbox for today's session. Please fill that out when you get a chance. The feedback is extremely helpful to us for the rest of the series, but also our program going forward. And again, if you can't remember exactly who to contact specifically, a reminder, we do have an echo@cardio.org email. And this will also get to our team. So any sort of comments, concerns can also be emailed there. Again, thanks very much. It's 9 o'clock. So we will see you next week. Have a great week, everybody.
Thanks, everyone. We'll see you next week.